Chapter 19 is on addiction and substance abuse. Now, this is definitely an issue, and it's going to impact many families, and there are probably many adults, families, and children who are living the life of substance abuse that we know and don't even realize have this issue within their family. The latest statistics said that 43% of all Americans have been exposed to alcoholism in their family, and also that children of alcoholics are 4 times more likely to develop problems with alcohol as well. An interesting study recently came out that said many adults that are in treatment today, that they admitted to having their first drink when they were 10 years or younger. So this is why we really need to be providing our primary prevention education to these school-aged children of 10 years or younger. Now we see DARE in the school programs now. DARE is usually in the 5th grade, and that may, I mean, this is kind of just a personal opinion, but that may see that shift to 4th grade instead of 5th grade, just because kids are, I worked in a school and it wasn't anything for a 3rd grader to have been drinking or even doing drugs as well. So we can't just, close your eyes and say that this doesn't ever happen, because it is happening probably in the community where you live, and your friends probably, or your children, if you have school-age children, don't be afraid to talk to them about it, because they probably know the terminology. They probably know more than what you think that they know as well. So make sure that you do have that conversation at home with them as well. Terms, these are just some terms that you need to make sure that you understand. Codependence. Now, this is basically when a person or a family member or someone has become preoccupied with taking care of the person who has the addiction, and basically just kind of enables them to continue with their addiction. They will often make excuses for the patient, and with the substance abuse, they may blame themselves, saying that they're the reason why the person keeps drinking or using the substance. And the book gave an example. It said that when a wife had continually called in to report that her husband is sick when he was really hungover or drunk. And this is an example of codependence. So this may appear helpful. The wife may have been thinking that she was being helpful, but it's really just assisting the husband with avoiding the consequences of his behavior. So just know there are both biologically and psychologically factors for a person becoming too addicted to drugs or alcohol. All right, so now we'll start talking about the substances. Polysubstance abuse, just know this terminology. Make sure you know that it's just the abuse of more than one substance. So the first one we're going to talk about is alcohol. Alcohol is the most common drug that is abused in the United States. And 50% of all traffic violations involve alcohol, and alcohol also plays a role in many suicides as well. Alcohol is going to affect basically every organ within your body. It's an central nervous system depressant that is rapidly absorbed through the stomach, small intestines, into the bloodstream. And the alcohol is metabolized by the liver, which is why we see psoriasis with patients that suffer from alcoholism. So when a person first consumes alcohol, the effects are going to be relaxation, and then when intoxication occurs, you're going to be seeing more of the slurred speech, the unsteady gait, the lack of coordination, decrease in memory and judgment, and those type of things. When a person becomes intoxicated, they're going to be at risk for possible aspiration or pulmonary obstruction due to some vomiting that can occur, and they could lose consciousness and also could have some respiratory depression as well. Now, these are some effects that could happen when a person is drinking for long term. The first one there is cardiac cardiac myopathy. This is also known as alcoholic cardiomyopathy, and this is when long-term alcohol abuse, it basically is just going to weaken and thin the heart muscle. And this damage that the muscle that has occurred, the heart muscle is not going to be able to pump the blood as it should, which in turn, is going to deprive the body of oxygen and the tissues of oxygen. So this can lead to multiple other health problems and even death as well. Wernicke's encephalopathy is an acute disease of the brain, and it is caused by a deficiency in thiamine. And it's usually associated with chronic alcoholism. Now, it can have other health issues as well, but right now we're just going to relate it to chronic alcoholism. And that is characterized by loss of muscular coordination. They're going to have some abnormal eye movements, and then also some confusion as well. Korsakoff's psychosis is a form of amnesia that is often seen as chronic alcoholics as well, and it is characterized by short-term memory and the inability to learn new skills. This person will really demonstrate as being disoriented, may have some delirium and some hallucinations as well. And this is often also caused by a lack of thiamine and also vitamin B12. So whenever you're taking care of an alcoholic, you're often going to see thiamine as a prescription along with vitamin B12 and multivitamins, and that is the reason why. Ascites is on there as well. This is caused by severe liver damage. And remember, alcoholism can cause severe liver damage. So ascites, this is going to be the buildup of fluid in the space between the lining of the abdomen and then the abdominal organs. And as the more fluid collects, they're going to have pain and they're going to have bloating. And they're probably going to be shorter breath as well. And so this is going to be very painful, very discomfort to the patient. And a lot of times they're going to go and have paracentesis to drain off that extra fluid that has accumulated. So alcohol withdrawal, it usually peaks about on day 2 to 3. And the patient is usually over it somewhere around day 5. Some patients can kind of detox at home, but others need to be admitted to the hospital for detox as well. Where they are in the hospital, they will often be given Ativan or Valium to help suppress the withdrawal symptoms, and these medications will then be tapered off depending on the withdrawal assessment that you, the nurse, will perform. So some signs and symptoms of alcohol withdrawal are anxiety, insomnia, tremors, and these will peak about 1 to 2 days after cessation or the reduction of alcohol. And they can also include confusion, illusions, elevated blood pressure, and heart rate as well. Alcohol poisoning, it's whenever the respirations are going to be 10 breaths per minute or less, or they can have some cyanosis under their fingernails, or they're just going to feel cool and clammy skin, and they're going to be difficult to arouse as well. So antabuse is a big drug whenever we talk about alcoholism. It's the most common medication used when a patient has the desire to stop drinking, but they need help doing so. So when you have a patient that's taking antabuse, if they drink anything at all, or the aftershave lotion, if they get anything on them that contains alcohol, it's going to produce a throbbing headache and it's going to promote vomiting. So this is why it's important that we have to educate them that they can't just stop drinking alcohol. They have to look in all these other products and make sure they don't ingest or put anything on their body that contains alcohol, such as cough syrups, mouthwash, aftershave lotion, alcohol swabs, stuff like that. Other CNS depressants that are frequently abused are benzos and barbiturates. Oral overdoses of benzos, they are really not life-threatening, but an overdose of barbiturates, they can be life-threatening. Barbiturates such as the Nembutal can cause coma, respiratory arrest, cardiac failure, and death. And it's also important to note there is not an antidote for barbiturates. No antidote for barbiturates. So if you have a patient who has overdosed, it's important to maintain the airway and provide airway support. And the physician will probably going to order a gastric lavage as well. And this basically is just pumping the stomach. And after they do this, they're probably going to administer activated charcoal, which will basically help absorb the drug that they are trying to remove. Remember, you have to do this after the gastric lavage, or it's not going to do any good, because if you give the activated charcoal and then basically pump their stomach, well, you're just pumping all that medication back out. And there's a picture of how that works. CNS stimulants. These are drugs that have a very high potential for abuse due to stimulation that it causes within the central nervous system. Cocaine and meth are the main ones in this category. So a person can overdose on these drugs as well, and it can cause respiratory distress, convulsions, coma, stroke, death, those type of things as well. When a person is coming off of a CNS stimulant, they can experience what is called a crashing effect. And this is basically just whenever they go into a deep depression symptoms, and they often have suicidal thoughts for several days. And this is why it's hard for these individuals to come off the CNS stimulants, because they would rather experience the euphoric, the hyperactivity, energy, rather than the suicidal thoughts, depression. Marijuana has been shown to cause problems regardless if it's legalized in certain states or not. It's going to cause impaired judgment, impaired memory, and it can cause a sense of detachment and other things as well. Overdoses are rare with marijuana, and Marinol is the prescription marijuana, or the legalized, prescription marijuana that is used to treat nausea and vomiting that's associated with the chemotherapy. Opioids, they can be legal or illegal, just kind of depends on if you have a prescription for it. Heroin, of course, as you know, it's going to always be legal, it's always going to be illegal. You can have an overdose of opioids, basically respiratory depression, coma, convulsions, and death. Just remember that the treatment for respiratory depression is going to be your Narcan. Methadone is often used for patients to help block the craving of opioids. Read over the hallucinogens and the inhalants. Self-help groups, just remember that you don't have to have a professional leading the group because it's a self-help group. There's many types of self-help groups. There's AA, NA, which is Alcohol Anonymous or Narcotic Anonymous, and they have the 12-step programs. And there's an example there. Read over those. Elder considerations. So late onset substance abuse, it can happen as well, especially for patients who have an illness and later in life that just causes lots of pain, or if they begin to experience depression or social isolation, that can happen with just the aging process as well. So we need to make sure that we are assessing the elderly for dependence and abuse as well. Chemically impaired nerves. So chances are you will probably come into contact with one during your nursing career. Just make sure it's not you. Just because nurses have access to these medications. So it's very important that you always waste your medications appropriately with another nurse. Okay, I can't stress that enough. You're gonna have to do that. It's just gonna save it's gonna save your butt when it comes down if they think that you are diverting medications or not. If you have to put a pill back, if you didn't give a pill, not even IV medications, but even if you put a pill back, make sure that you are always having someone check those off with you. If you do suspect that you have a coworker that is diverting medications or is impaired, you need to make sure that you report that to your manager. It's your responsibility to take care of those patients. Read through those signs of substance abuse, and we'll talk about this more in leadership as well.